Hi all, I'm Dr. Malathi, working as a professor in Trippuram College of Nursing. So in this video, I'm going to discuss about the mechanism of labor LSA, left sacro-anterior, which comes under the breech presentation. So this is going to be a demonstration procedure for BSc nursing students, post-basic and for the MSc nursing students. Objectives are introduction, definition, principles, characteristics, movements, summary and conclusion. Introduction. LSA, left sacro-anterior, is a fetal position in which the sacrum of the fetus is directed towards the left anterior side of the mother's pelvis. It is commonly seen in breech presentation and is considered as a favorable position for delivery. So in LSA, the fetus aligns well with the maternal pelvis, allowing the smoother progress of the labor. So understanding the left sacro-anterior for nursing students to assess fetal position and provide the appropriate care during the labor process. So on those days previously, all these breech presentations, the obstetricians try to conduct as a normal delivery. But nowadays, they are shifting the mother towards the cesarean section. Definition for mechanism of labor. So the definition principles are same for all the 8 mechanism of labor. So the definition is, as the fetus descends, soft tissue and bony structure exerts pressure which leads to descent through the birth canal by the series of movements. Principles. There are 3 main principles. Descent takes place throughout the labor. Whichever part leads and first meets the resistance of the pelvic floor will rotate forward until it comes under the symphysis pubis. Whatever emerges from the pelvis will pivot around the pubic bone is the third principle. Characteristics are: lie is longitudinal, attitude is one of complete flexion, presentation is a breech, position is left sacro-anterior, denominator is sacrum, presenting part is anterior left buttock, and the diameter is bitrochanteric diameter, that is 10 cm, enters the pelvis in the left oblique diameter of the brim, and the sacrum points to the left iliopectineal eminence. Movements. First movement is compaction. Here the descent takes place with increasing compaction owing to the increased flexion of the limbs. Second movement is internal rotation of the buttocks. Now the anterior buttocks reaches the pelvic floor and it will rotate 1/8 of a circle forward along the right side of the pelvis to lie underneath the symphysis pubis. As I told you earlier, the bitrochanteric diameter is now in the antero-posterior diameter of the pelvic outlet. Lateral flexion of the body. Anterior buttock escape under the symphysis pubis. Posterior buttock sweeps the perineum and the buttocks are borne by the movement of lateral flexion. Next movement is restitution of the buttocks. Anterior buttocks turn slightly to the women's right side. Next movement is internal rotation of the shoulder. The shoulder enters the pelvis in the left oblique diameter of the buttocks. The anterior shoulder rotates forward 1/8 of a circle along the right side of the pelvis, and now it will escape under the symphysis pubis. Then the posterior shoulder sweeps the perineum and the shoulders are borne. Next movement is internal rotation of the head. Head enters the pelvis, that is, the sagittal suture will lie in the transverse diameter of the pelvic brim. The occiput rotates forward along the left side and suboccipital region will impinges on the undersurface of the symphysis pubis. Next movement is external rotation of body. At the same time, the body turns slightly and the back will become the uppermost. Last movement is birth of the head. The chin, face and sinciput sweeps the perineum and the head is borne by the movement of flexed attitude. Summary. Left sacro-anterior is a favorable fetal position seen in breech presentation where the sacrum of the fetus is directed towards the left anterior side of the mother's pelvis. This position allows better alignment of the fetus with the maternal birth canal facilitating smoother progress of the labor. Proper understanding of LSA helps in accurate assessment and monitoring during delivery. Conclusion: LSA is considered a normal and advantageous position in which breech presentation that support effective labor. Knowledge of this position enables the nurses to identify the normal progress and to detect the deviations early. Timely observation and appropriate care by nurses can help ensure a safe outcome for both mother and baby. References. Thank you.